In 1989, the Governing Council of the United Nations Development Programme recommended that July 11th be observed by the international community as World Population Day, a day to focus attention on the urgency and importance of population issues. The theme of this year's World Population Day is Vulnerable Populations in Emergencies. The world is seeing a record number of people displaced by crisis, some 60 million according to the latest United Nations figures. United Nations Population Funds works in emergency settings around the globe and in Vietnam since 1977 to respond to the rise and needs of women and girls, helping them maintain their dignity, securing their safety, and restoring their access to sexual and reproductive health care.
Ladies and gentlemen, welcome to Sharing Vietnam on VTC 10 Net Viet. In our program today, let's find out about this year's Populations Day in Vietnam activity through the shares of the Acting Representative of UNFPA in Vietnam, Ms. Ritsu Nacken. Thank you so much for joining Sharing Vietnam today. First of all, this year Population Day theme is Vulnerable Populations in Emergency. So why would UNFPA choose this theme?
As you know, that climate change is having a major impact these days, and that's why UNFPA decided we need to talk about population issues in emergencies. Here we are talking about vulnerable women and girls' needs in emergencies, including the post-conflict situation, as well as the natural disaster situation. Women and girls have very specific needs in these difficult times, but often their needs are neglected. For example, you may recall there was a big earthquake in Nepal just 3 months ago, claiming more than 8,000 lives around the Kathmandu area. In this emergency situation, there were actually 2 million women and girls who needed immediate assistance. Among them, more than 126,000 women were pregnant. So UNFPA on the ground provided necessary care for these women and girls. One of the women who were supported by us told us that, of course, food and shelter are important in this situation, but having decent hygiene and clean underwear really makes me feel that I'm a human being again. So this testament just tell us how important it is to consider women and girls' needs in these situations.
And how would this topic relevant to the context of Vietnam?
Actually, Vietnam made incredible progress in addressing these needs of vulnerable population in sexually reproductive health services. However, the government support has been mainly targeting the married women and men. So we consider young people, especially adolescents, are more vulnerable, and they need more support to ensure that their reproductive health and healthy lifestyles. Also, the ethnic minority youth is our target population, and they are often having access issues in the remote areas. Another population is the migrants. As you know, that many rural area populations nowadays moving to the urban areas, industrial zones, and they may have less access to reproductive health services and information. So we want to make sure that those people can benefit from the information and services that they need.
And with this year's World Population Day, what will UNFPA do in order to celebrate this event? And what impact would UNFPA hope for this event to have in Vietnam?
Yes, in cooperation with our partners, MOH, particularly the GOPFP, we are conducting a major celebration, and we selected a localized topic related to the global theme, which is increasing vulnerable populations' quality, reproductive health and family planning services in natural disaster. Vietnam is one of the countries that are affected most by natural disaster and climate change. First of all, we would like a lot of policymakers to be aware of this particular topic and the needs of women and girls. I think in the planning for the preparedness, particularly they could do more to integrate how they address the needs of women and girls, particularly pregnant women, and make sure that all women and girls can enjoy their reproductive health and reproductive rights even during the emergencies.
Recently, Third United Nations World Conference on Disaster Risk Reduction took place during March in Sendai, Japan. Here, the need for resilient health systems capable of delivering quality sexual and reproductive health and the crucial role of women in reducing disaster risks were discussed. Representatives from 187 countries have adopted the Sendai Framework for Disaster Risk Reduction 2015 to 2030, making it the first major agreement of the post-2015 development agenda.
Our discussion should be a springboard for action. We live in an interconnected world. We can build on each other's successes. Each country can contribute with lessons learned. I expect everyone to step up to this truly global challenge. Governments, businesses, and of course it requires collective responsibility and action.
With the theme, Increase Vulnerable Populations Access to Quality Reproductive Health Care and Family Planning Services in Natural Disasters, on the occasion of World Population Day this year, the whole world is concerned and resolved around the vulnerable populations. Vietnam also has many activities geared to these audiences. With many challenges posed by population sector, representatives of the General Office of Population and Family Planning stressed the goal of improving the quality of healthcare services and skills to cope with natural disasters, which focuses in improving capacity of the management system and population staff.
Many countries in the Asia-Pacific region have now implemented or introduced what is called a gender-responsive budgeting. So looking at the budget allocation, where are the government budgets going? Are they equally benefiting women and men? Or looking at, for example, the National Program on Gender Equality and looking at how much resources have been allocated in this past years compared to other sectors, and trying to track the budget allocation is an important element of making sure that gender equality is an issue that across the government there is enough investment being made of. And these new tools we are working with the government to bring to Vietnam.
Besides, with the limitations and shortcomings of population ordinance implemented since 2003, the Ministry of Health is currently proposed population law to solve the limitations, shortcomings, and creating the basis legal framework to meet the pressing needs of the population work practices.
After many years of operating in Vietnam, how does UNFPA views the effort of the Vietnamese government in providing reproductive health service and family planning for vulnerable populations?
As I mentioned earlier, I think Vietnam is one of the model countries. They have done a lot, and neighboring countries are looking at Vietnam as a very much a success country and success story. However, there are some populations still suffering from the limited access to reproductive health information and services. We need to target them, such as the ethnic minority youth, the migrants, and those are quite young, like adolescent ages. We need to make sure enhancing, for example, the comprehensive sexuality education, so that even youngsters can really have a correct, accurate information, age-appropriate information about sexuality, and properly learn the gender equality. And that will really strengthen the country and the future of the country.
Regarding the issues of climate change in Vietnam and the consequences that Vietnam are exposed to, what is the role of the public health service and family planning in order to tackle this issue in Vietnam?
Very good question, tricky question. But we feel that it is important that these issues are mainstreamed in the discussion of climate change, both in terms of preparedness and adaptation. And if you look at the Hyogo framework and the recent discussion in Sendai in Japan, that the reproductive health issues were integrated in this kind of declarations. That means in the world, the policymakers are aware that this issue has to be part of the discussion when you prepare for the disaster to happen. And particularly in the middle-income context, like Vietnam, we do focus mainly on the policy process. For example, we are now discussing the population law and also the youth law revisions. So likewise, I think whenever the chance happens that it's open for us to support the government, we come with the technical expertise as well as the international evidence, the experiences, to share with the Vietnamese policymakers so that they could make sure that the laws are based on the evidence and also more useful and appropriate for the Vietnamese population.
And has there any changes in the views and in the commitment of Vietnam in order to provide better reproductive health service as well as family planning for the vulnerable populations in Vietnam?
Absolutely. Actually, not only for the rural areas, but we work very closely with the parliamentarians, for example. And initially, I think they may not have a very technical knowledge about reproductive health. But through working with us, they have learned a lot. Especially they were exposed by the international experience and evidence. And they are much more now committed to ensure the reproductive health and reproductive rights are integrated in the Vietnamese legal system as well as the policy framework. So I believe that the Vietnamese government is very open to our support and also learning from international experience. So we've been enjoying a great partnership with the government colleagues.
Thank you so much for all of your sharing today. And that's the end for Sharing Vietnam today. Thank you so much for watching us. We hope that through this show, the public will understand more about the role of women, how they play a vital role in carrying the reproductive health of the communities in Vietnam, and to ensure the health, dignity, and services that is ensure the well-being of the families and community. Any questions and recommendations, please email to sharingvietnam@netvittv.net. Thank you and see you again.